Hi guys, Greg from Complete Game Physical Therapy here, located in Lowell, Massachusetts. So continuing on with our foam roller series today, I wanted to talk about an area that's commonly tight in people, particularly with back pain and hip pain, back problems and hip problems, and it can be that area that's kind of right in the back of the hip, kind of near the glute, but just below the lower back. And it's a great area to work with the foam roller. And I want to show you how to do that today. So you're going to get right up on that foam roll, and you can either just kind of roll to the side, or you can even cross the leg over, and you'll get that area. There's a lot of muscle attachments in here, so it's an area that commonly, again, is tight in people with, with soreness in the back, soreness in the hip. And again, a great area to work out before you run or before you have your exercise for the day. So just kind of, again, find those tight spots, kind of stay on it, 30, 60 seconds maybe, and then rolling back and forth. Make sure you do both sides. Again, it may be sore, but should be good sore. It shouldn't be painful, and that should help loosen you up before your workout. So that was the tip for today. Make sure to check us out on Facebook, Twitter, Instagram, and we'll see you back next week for another tip. Thanks.